Happy Monday and happy new month. And what a doozy of a month it has been already. I typically do these videos on a variety of topics in our family group on Facebook. However, have been looking towards the option of recording these videos, uploading them to our YouTube channel, and then posting them into our family group from there. Today, Facebook happens to be out of commission, so guess what's happening today? And maybe from now on. Maybe moving forward, I'll just start doing this so much easier. So not only will we eliminate the issues that the social media platforms have been presenting our mission with education and awareness challenges, our content just isn't being seen. We don't have enough manpower to live up to the standards that we need to live up to break the algorithm. But, also these videos will be available indefinitely as long as the YouTube channel sticks around, right? So I'm Ali Harper. I am the founder, chief family advocate, and executive director here at Global Hydranencephaly Foundation. And today is the start of Malnutrition Awareness Week. So I'll be talking about malnutrition and its risks, as well as the frequency this occurs in children and adults who are living with life-limiting conditions and medically complex diagnoses. So created by the American Society for Parenteral and Enteral Nutrition, ASPEN, the purpose of Malnutrition Awareness Week is to raise awareness about the perils of nutrition and provide clinicians working in the field of clinical nutrition and metabolism with strategies to help eradicate the problem. Great mission. But first, a quick sobering fact. I'll be sharing a lot, but just this one to start with. Nutrition in the hospital setting is important despite its often being viewed as merely secondary. The fact is that proper nutrition during hospital care goes a long way toward improving a patient's condition, and this is even more so important for an individual who is already living with medical complexities. It is estimated that 1 in 3 patients is malnourished upon admission to the hospital. That rate is almost 100% for those who have additional healthcare needs. Why is this so important? Because malnourishment has been shown to impact a patient's time to heal, their readmission rates, organ function, stability, and even their mortality. The following that I'm going to share is directly from a special report called the Consensus Statement of Aspen. It's from Aspen. It's the indicators recommended for the identification and documentation of pediatric malnutrition or undernutrition. So pediatric malnutrition, also called undernutrition, is estimated to contribute to approximately 45% of all child deaths globally. Approximately 20 million children less than the age of 5 worldwide are severely undernourished, leaving them extremely vulnerable to illness and premature death. Many older children in developing countries enter adolescence undernourished, which actually increases their vulnerability to disease and premature death. Poverty, famine, war, those are all primary contributors to global malnutrition and limit food distribution and access, even when food is available for consumption. Development of acute or chronic infectious and/or diarrheal disease in those who are already undernourished contributes to the high mortality rates associated with pediatric malnutrition in developing nations. So undernutrition, especially in the pediatric community, has historically been considered an issue exclusive to developing countries. When you think about this topic, you're probably thinking about those old videos of Cambodia or Ethiopia, the little babies with their bellies all swollen, malnourished. Much of the groundbreaking research and initial development of malnutrition criteria occurred with populations outside of the United States, where acute or chronic infections and/or diarrheal disease are major contributors to its development and to high rates of mortality. However, the clinical perspective and description of undernutrition has evolved during the past 3 decades. So unlike the undernutrition typically observed in developing countries, and usually categorized as marasmus or kwashiorkor, undernutrition in developed countries generally occurs in the setting of acute or chronic illness. which brings us to this topic, right? A number of U.S. children suffer from energy imbalance and excess rather than nutrient deficiency. So it's estimated that approximately 17% of U.S. children and adolescents between the ages of 2 and 19 years of age are obese. Other data sets estimate that 1 in 10 U.S. households with children struggle with food insecurity. The current prevalence of U.S. children who experience acute or chronic undernutrition is unknown. Children and adolescents who live in homeless shelters are victims of abuse or neglect, live in urban or rural areas where access to high-quality food is difficult. All of those children are thought to be at an increased risk for undernutrition and underreporting of undernutrition. In the United States, this topic is most frequently observed in hospitalized acute or chronically ill children, and in the U.S., children with special healthcare needs. Children who have special needs are defined as those who have or are at an increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that of children generally. So this definition encompasses children with nutrition-related chronic diseases or condition, congenital anomalies, severe acute illnesses, injuries, rare disease, any of those also affected by abuse or neglect. Children and youth with special healthcare needs should be routinely screened for malnutrition in primary care settings. Should be. Registered dietitian nutritionists, which are called RDNs, nurses, all members of the healthcare team should be working in a collaboration to ensure that screening for malnutrition becomes an integral part of the routine pediatric care, especially when kids are already carrying around all of these complex medical complexities. Research, unfortunately, is limited. Malnutrition in this population definitely has been shown to lead to more complicated hospitalizations, due to progression of the underlying disease or the condition, maybe poor wound healing, poor surgical healing, slow return to a previous level of activity. It's difficult for the children to return to baseline if they're undernourished. Complications that can significantly increase the length of stay and the cost of the hospitalization. All of these things can be directly linked straight back to malnourishment. Comprehensive assessment and nutritional intervention in undernourished and malnourished children in primary care settings definitely reduces the need for more costly hospitalization by simply addressing nutritional deficits that may predispose the patient to, more severe acute illness or even just exacerbate the underlying disease or condition. There are some older studies that suggest that up to 25% of all hospitalized children experienced acute protein energy malnutrition, and approximately 27% of children in the community, those children experience chronic food insecurity. All right, so let's go back and talk about malnourishment specifically in babies and toddlers. I'm pinpointing this targeted group because I feel like this is where it all begins and this is where it's most often overlooked. So the causes for malnutrition in babies and young, it's not a disease, it's not a disorder in itself. Think of it as a sign that a baby or a child is undernourished and can't grow or gain enough weight, right? There's often this big misunderstanding that malnutrition means a child isn't getting enough nutrition, and that's really not the case. A parent can be giving their child everything that child needs, and they can still be malnourished. But malnutrition occurs when a child isn't getting the right nutrition to be able to grow normally. So this could be because the child isn't receiving enough calories. Some of the reasons for that could include maybe the formula is inconsistent to meeting the baby's need. Maybe the formula isn't being measured correctly. This often happens in high poverty communities where formula is not being provided to those families and they're trying to really stretch it out to save money. Maybe calories are restricted to avoid causing weight gain, which can be very, very dangerous. And I see this happen a lot with special needs kids. Maybe caregivers just don't notice hunger cues, or maybe the babies aren't able to give hunger cues all of the time. And like I said, just a lack of funds, high poverty communities, it's really difficult to buy enough food for the entire family. Um, Maybe the child can't take enough calories. So kiddos may be having trouble taking in enough food for a lot of reasons. It can be things from chronic medical problems, maybe if they're premature. Some babies, if they have an undiagnosed heart disease, they have difficulty eating. Um, some children may develop a feeding aversion that can cause malnutrition, and that just means they do not want to eat because they have health problems, or maybe they're undergoing medical treatments, or changes to their diet just makes them not want to eat. There's lots of different things. Some kiddos simply cannot retain enough calories. Babies who have chronic constipation that alternates with diarrhea or colitis, those babies, it can make it hard for them for their little bodies to hold on to the nutrients and calories from food. Other conditions that can cause a problem with this would be like chronic liver disease, maybe food intolerances, gluten allergies, cystic fibrosis is often brought up. Those things just make it really difficult for a baby to absorb and keep the nutrients in the body. So in which case, a lot of the time, these babies need a special medical diet. Some less common health problems and genetic conditions, things like metabolic disorders, inborn errors in metabolism, they can just change your child's body's ability to process nutrients well from a typical diet or even safely. So those children often need medical evaluation and treatment to grow and thrive. And this is really common in cases of kiddos who have hydranencephaly. So how does malnutrition affect babies and children? So I'm talking specifically about this age group because that is who we work with most often and where we see the most cases of undernourishment. For infants and toddlers, the first 2 years of life is a vital time when their bodies and their brains are developing. And yes, this even applies to children with hydranencephaly who are missing a large area of their brain tissue. Their brain is still developing, and nourishment is really important. Typically, a baby's brain grows as much during their first years as it will for the rest of their life. So you want to encourage the possibility of growth of brain tissue and neural pathways as much as possible, even more so than you would in a typically developing child. Poor nutrition during this time can cause really serious long-term harm to a developing brain, and that even includes those brains who will not fully develop. Some other problems that may arise from malnutrition in children, including not reaching their optimal size as adults. And this wouldn't be an issue because we kind of find it much easier to take care of medically complex kids if they stay smaller, but it may lower their physical capacity. As they get older, they might have more difficulties spending time in their stander or using their gait trainer because they're not having their nutritional needs met. It makes it much more difficult for them to perform in physical activities, to perform work, to even function in school. It can lead to learning problems. Our children already have so many deficits in learning that thinking about the fact that malnourishment could contribute to that being an even bigger issue. And this one is huge, a reduced immunity, leading to the risk of contracting more infectious diseases. We do not want to risk any blows to our kiddos' immune systems. So understanding their nutritional needs, making sure that their needs are being met is crucial, crucial, crucial. So recognizing the signs of malnutrition, you may notice these warning signs of malnutrition. I've talked about weight, size, stature, problems with weight in general, whether that be, slow to gain weight, excessive weight loss, being underweight, maybe being overweight. Any of those things are a sign of malnutrition. if they're not growing taller. Again, this isn't as crucial as of an issue in children who have hydranencephaly, um, just due to the development of their brain. Lots of other factors come into play there, but you do want your child to stay on kind of a growth curve until they reach the end of their growing cycle. Um, an easy way to pay attention to that is if they're just not outgrowing their clothes. They might grow a little smaller or a little slower, but if they're just never outgrowing their clothes, say they're 10 years old in a size 2T, there might be a cause of concern for malnourishment or undernourishment. If your kiddo is just eating less than usual or they're having no interest in eating over an extended period of time, of course, eating less at certain times can be completely normal at various ages and developmental levels, but if it continues for an extended period of time and you're really being strict and structured with a eating plan for them and an eating schedule, then it might be something to consider their nourishment needs. Maybe your kiddo's not eating well because of stomach problems. GI trouble is a serious issue for children with hydranencephaly. But that can be helped with a full nourishing diet as well. So it's something to explore, record. I'll talk about it more in a minute. Maybe you'll see your kid being less active and playful, or they're sleeping more than usual. A lot of the time, this can be something else. If a kiddo is shunted, I always point to getting a shunt check first. But if everything else pans out fine and they're just not as aware, they're sleeping a lot more than usual, they're probably malnourished. If your family's meal or feeding times just become really stressful because your child is struggling with their own eating problems, please get help from somebody. It shouldn't be stressful for you to make sure that your child's needs are being met. You can start by seeing your child's doctor, your primary care doctor, pediatrician, whoever the number one ACE is for your child's care team. If you think your kiddo might be at risk for malnutrition, just get some help. Don't be afraid to ask. Start by talking to that doctor, your number one doctor on the team. Your pediatrician, particularly, they can help assess your child's growth pattern. They'll use tools like a growth chart, Z-scores, but do make sure that they are using those of children in comparable health. I recommend comparing to other kids with, say, a cerebral palsy. The doctor can also, from there, refer you to a specialist if needed. And I instead just highly encourage you to do that from the get-go. Find a specialist who has familiarity with children who have complex medical conditions that are going to impact their development and their nourishment needs. So some of those specialists you might see: lactation consultants for breastfeeding infants. Crucial, 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 crucial. They're amazing. Another amazing person to add to your team: pediatric feeding therapists. Your occupational therapist, that early intervention in those first crucial years should be provided to you. Same thing with speech and language pathologists. If they need help with swallowing disorders, maybe there's something going on in there that you can't tell from the outside, something that's interfering with bottle feeding or consumption of solid foods orally, seek help from a speech language pathologist or a occupational therapist who can kind of see what's happening inside of their mouth and what's going on with their tongue and their swallow reflex and all that stuff. Also, registered dietitians, just to help improve nutrition and provide a variety of food options. I think that the big problem with malnourishment here is that a lot of doctors are quick to say, oh, well, you know, they're atypical in development, so their nutrition needs are going to be atypical. Atypical is one thing, but atypical to the point where you just don't care whether they're having all of their nutritional needs being met, that's a big difference and a big problem. There's a lot of factors that play into a part of a child's health and development, and of course nutrition isn't the only one, but it's the biggest one. Like I said, malnourished children, they might be short for their age, they're going to be a little smaller, they could be thin, or they could look bloated or obese. A lot of the time they look really listless. They definitely always have a weakened immune system, something that you can't sacrifice on this journey. Nutritional disorders can affect any system in the body, and it's going to affect their senses. They're going to be affected, their smell, their taste, their sight. They might also show signs of anxious or irritability or other psychiatric symptoms that would be very obvious in a typically developing child, and you'll have to look a little harder in a child with hydranencephaly, but they could still be there. So some of those other symptoms that you don't often hear about with undernourishment, that include pale, thick, and dry skin. If your child has tons of skin disorders, it's time to look at their diet. If they're bruising easily, check on their diet. Rashes, same thing with that skin thing. Rashes, changes in their skin pigmentation, if it's more red than normal, or if you have brown spots or whatever. Look at your child's hair. If their hair is really thin, maybe in some place it's really tightly curling up or looking frizzy or frayed, maybe it pulls out really easily when you're taking care of their hair, brushing it, whatnot, time to check out their diet. If they're fussing, they could be achy. Their joints could be aching. Their bones might feel really soft and tender. You won't feel that to the touch, but they could just be achy and miserable. Oral care, if you're brushing your teeth, their gums are bleeding easily, sign of undernourishment. Maybe while you're in there, if their tongue looks a little swollen, or maybe it's really dry, maybe you're seeing some spots on the sides of the tongues or on the gums, also a sign of undernourishment. And then increased sensitivity to light and glare, or it seems like, I think in our kids it usually presents as like a fear of the dark. So at dark, they have a more difficult time seeing. It could be related to their vision. Most kids with hydranencephaly have cortical vision impairment, but if this is something that's not being, you don't see an improvement with therapy, vision therapy, then it might be time to look at their diet. And it's always a good idea to look at the diet. So when this is diagnosed, doctors are going to look at their overall appearance. They're going to ask about their behavior compared to baseline. Maybe you don't have a baseline where they weren't undernourished, but you're going to want to look at the baseline of, maybe look to our family groups to ask questions about baseline behaviors. Compare your child to that. Look at their diet. Your doctor should be looking at body fat distribution and organ function. Those things can really alert a doctor to the presence of malnutrition or undernutrition. Parents are probably going to be asked to record what your child eats during a specific period. They can also do x-rays to check bone density and look for GI issues. They can explore the heart and lungs. All of those things will show signs of malnourishment. And then of course blood and urine tests, because they'll be able to check, levels of vitamins, minerals, waste products, all of those things that your body should and should not have will show up in blood and urine tests. So treatment, of course. Patients who cannot or will not, or who are unable to absorb nutrients taken by mouth, can be fed intravenously with just parenteral nutrition through the veins. That is usually not the first resort for children with hydranencephaly. Usually it is through tube feeding, and that's often used to provide nutrients to patients who have various swallowing issues or even digestive issues. The procedure involves inserting a really thin tube. Initially it usually starts with an NG tube, which goes through the nose and is carefully guided along through the throat until it reaches the stomach or the small intestine. If that is usually what's used if it's a short-term feeding issue, like during a bout with a sickness or something like that. But then if a long-term tube feeding is necessary, the tube may be placed directly into the stomach, might be placed directly into the small intestine through an incision in the abdomen. A really quick procedure and really life-changing. Another option is just to reach out to us here at Global Hydranencephaly Foundation to discuss your child's nutrition needs. We do not currently have a certified consultant on board yet, but we do possess extensive knowledge on food for healing and health, and we can absolutely help you to help your child in meeting their health needs through diet and movement, whether they have a feeding tube or they're taking their nutrition orally. All you have to do is say the word. It's really quick to reach out. You can reach me. I typically prefer the Marco Polo app, but you can reach me at that Marco Polo app at 573-280-2412. I do not often get phone calls or text messages at that number, but Marco Polo typically works for me. You could also reach me via email. My email address is president@ghf.life. So you can reach me at either one of those places, or just reach out to me on the web if we are connected in a different platform. But that is that on our topic this week. I am likely going to just start recording our videos here and adding them to our YouTube channel. That way they're accessible to families indefinitely, and we can reach more people with our information. So I will see you next time with another topic.